Welcome to Suite 250 at Cool Springs Foot Care. My name is Dr. Lance Reeves, and today I wanted to talk about what to expect after a minimally invasive hammer toe surgery. There are a lot of people out there who are afraid of getting their hammer toe fixed because they've heard the recovery process is so difficult or uncomfortable. I am here to tell you today that the process and the recovery is probably not going to be as bad as you think. With minimally invasive hammer toe corrections, that requires only a tiny 2 to 3 millimeter incision. I also don't use any pins, plates, screws, or hardware. So this is going to make the surgical footprint, scarring, and the pain less than a traditional open hammer toe correction. This typically results in less pain, faster recovery, and minimal scarring. First, we're going to talk about how much time you'll be off your feet after the surgery. You will be off your feet for 0 days after the surgery. That's right, I said 0 days. Immediately after surgery, you will be walking out of my office. Now, certainly after surgery, you won't be able to do all of your normal activities as prior to surgery in the acute recovery process, but you are still able to walk around the house, use the restroom, run small errands. Everything like that is perfectly fine. One concern I hear about patients not wanting to get their hammer toe fixed is because they're going to have a pin sticking out of the end of their toe. For my hammer toe surgeries, I use no pins. That means you will not have a pin sticking out of your toe if you get your hammer toe corrected by myself. Because I specialize in this minimally invasive surgical technique, that allows me to not use any pins when I'm correcting your hammer toe. After the surgery, you will have external bandaging or splinting that will hold the correction of that toe to give you a nice, natural looking toe, not a straight, rigid toe with a pin sticking out of it. Next, we can talk about what you'll be wearing on your foot after the surgery. Typically, this is going to be a cam boot or a surgical shoe. Two things that I consider are, one, how extensive the surgery is. If it's a larger surgery, patients are more likely to be in a walking boot. If it's a smaller surgery with less procedures, they're more likely to be in a surgical shoe. And two, if a patient has an unsteady gait or is a fall risk, then I'm not going to put them in a walking boot, as that could increase that fall risk. So that patient is going to be in a surgical shoe to help decrease their fall risk and not make their gait more unsteady. Ultimately, my decision on whether a patient gets a walking boot or a surgical shoe comes down to what is in the patient's best interest and what is going to give them the best recovery process. The length of time that a patient will be in a surgical shoe or a cam boot, again, depends on how extensive the procedures are. More surgery means a little more time in a surgical shoe or cam boot. Less surgery means less time in that surgical shoe or cam boot. For a smaller procedure, patients can be back in their normal shoes within 1 to 2 weeks after these minimally invasive hammer toe corrections. Usually, the amount of swelling will determine how quickly a patient can get back into normal shoes. Once the swelling goes down enough to where a patient can fit in their shoes, then I say they're okay to get back into their shoes. Pain is another common concern I get about patients when they're talking about possibly getting their hammer toe corrected. But again, because I use tiny 2 to 3 millimeter incisions for my hammer toe correction, that pain is going to be typically much less than a traditional open surgery. In most of my cases, patients can get away with only Tylenol or ibuprofen for post-op pain control. In some cases, patients have needed a stronger pain medication, but I have rarely, if ever, prescribed that for more than just 1 week after these minimally invasive hammer toe corrections. Obviously, everyone's pain tolerance is a little bit different, and that's why I keep a close eye on my patients after surgery and follow them weekly to make sure their pain is well controlled and they're comfortable as they're going through the recovery process. For the first few weeks, it's important to rest and take it easy. Again, patients can walk and I encourage them to walk, but they still need to rest, and when they're resting, elevate their foot, and they can ice their foot 10 to 15 minutes per hour to help with some of that post-op inflammation. After the surgery, I like to see patients 3 days post-operatively. That way I can see them very quickly after surgery, make sure everything is doing okay for them. After that first post-op appointment, I will see my patients once a week for 5 weeks. That way I can keep a very close eye on them and make sure they're progressing well through that post-operative course. This also allows me to do all of the patient's dressing changes for them. I don't want to ask the patient to do that. I would prefer to handle that and give the patient the peace of mind in knowing that the surgeon who did their correction is also performing all the dressing changes and splinting for them during that post-operative process. Getting back into normal activities is going to be a little bit different for everyone, but there are several things that everyone will see as they go through their healing process. First, radiographic healing, meaning the x-rays look good and there's healing across some of those osteotomy sites. Second is clinical healing, meaning the incisions are healed, and the swelling is decreased enough so patients can get into their normal shoes and/or normal activities. Next will be range of motion and strengthening exercises, and this is initially determined by myself. If patients feel they need extra help in this realm, I am more than happy to get them into physical therapy. And lastly, it's a gradual return to your normal activities. This means you start slow, start small, and slowly work up into what was normal prior to the hammertoe correction. To recap the highlights of what to expect after a minimally invasive hammertoe correction from myself: first, you will be walking immediately after surgery. There is no downtime off your feet at all. Second, and most importantly for some people, there will be no pin sticking out of your toe. Again, I will never use a pin to correct your hammertoe deformity, and you will not be stuck with that for 6 to 8 weeks if I'm the one doing your surgery. Lastly, I will be the one and only one doing all of your post-op dressing changes and giving you the peace of mind that your surgeon who did the correction is following you through the entirety of your post-operative course. If you have any questions or concerns about minimally invasive hammertoe correction, I would love to sit down and talk through some of those options or what that looks like with you. You could also call the office at 615-567-5622, or you could visit us online at coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.